Now, for any of you who've ever had your blood pressure tested, and I'm pretty sure there's lots of you out there, which arm did your doctor or nurse choose? You might not think it matters, but now researchers say that testing both arms is really important, and it could help discover serious medical conditions which might otherwise go unnoticed. Well, we've invited Dr Iqbal Malik from the London Cardiovascular Clinic to come in and talk about this. I mean, why is blood pressure still so important as a diagnostic tool?
Well, I think we've never lost the ability to actually raise blood pressure, and the higher the blood pressure is, the higher your risk in the long term of both heart attacks, strokes and heart failure. So spotting blood pressure, which produces no symptoms when it's mildly elevated, is very important, and the only way to do it is to measure it.
Okay, well, you know, you've brought in your kit. Why don't you go ahead and test my blood pressure? You know, I'm fairly sure I'm a pretty healthy individual, but let's put this to the test. But,
right.
but basically, when you measure people's blood pressure, you usually choose just one arm, don't you?
I tend to choose the arm that's closest to me.
Yes, well, this has been my practical experience, actually, that generally doctors just grab the nearest arm. But this study is essentially saying you should always do both arms.
This is a study that's looked at previous studies. It's not new work, it's putting together old work. And what it's saying is that if you do detect a big difference between the two arms, the chances are there may be already some hardening of the arteries in the arm blood vessels.
Okay.
And that is a risk factor for
and you
ongoing
need the
trouble.
two readings to do this. How am I doing on this one?
So we're just about to get the first answer, I would hope. And
while I hold my breath.
That's fine. It's 139.64, which is very reasonable, especially given that you're live on TV.
Yes, well, so you know, we try and keep calm in the studio, at least on a normal day. Okay.
So we would do it on the other arm
Yeah.
and see if there's a difference. Now, the first thing to say is, of course, this is your second reading, so you've become used to having blood pressure taken. You become more used.
Only 5 seconds ago, the first
and
reading.
That's all it takes. It starts going downwards very quickly. So we may find that this reading is going to be automatically lower. And of course, that doesn't mean you have hardening of the arteries. It just means you're calming down as the blood pressure is taken again.
Okay.
So the problem with doing blood pressure in both arms routinely, and actually, to be honest, it's gone up on that side. I've stressed you out.
I've defied the norms.
So I think the problem with the study is that it takes quite a long time if you're going to do it properly. Probably 2 readings in one arm, 2 readings in the other arm, and then compare the average difference between the two of them. Blood pressure is important, and I think often I sometimes measure the blood pressure in both arms to see what the higher reading is and treat on the higher number. But our guidelines now say that just measuring anything in clinic or on live TV gives you an artificially high measurement, and so before you start tablets, which will be for the rest of your life, you need a 24-hour monitor of your blood pressure to get your real average.
Okay, so perhaps it's not practical. So just very briefly, are you going to start, I'm a patient in your clinic, are you going to start doing both my arms?
I'm not actually. If I'm worried about one, I might take the other, but it's the average and also putting it into context of your overall risk profile. Because before I start doing anything to you, I want to know whether you're smoking, what your cholesterol is, do you have diabetes,
no smoking,
all of those
no
put together.
I hope. Okay. Thanks very much. That was my first ever live medical checkup
You did
on
well.
air. Thank you very much. Come back and see us again.
Okay.
Dr Iqbal Malik. That's it from Impact today. Don't forget the EU summit is just getting underway in Brussels. The leaders are just about to sit down for their talks, and we will have full coverage in the next few hours on the BBC. Their main aim is to come up with a new intergovernmental fiscal treaty. Goodbye.